We're going to go to Bichat Hospital in Paris, where that French patient is currently being treated. Let's touch base there with France 24's Antonia Kerrigan. Antonia, what more can you tell us?
Well, I can confirm what you've said, that she's breathing with an artificial lung and that she's in critical condition. The news in the last few hours has been, however, that her condition has somewhat stabilised. She is, of course, just one of 5 patients being held in the building behind me in high-tech isolation. This with the help of what are called negative pressure rooms. These are special rooms designed to prevent any leakage of potentially contaminated air into the hospital at large. The 4 other patients, though, are there because they are contacts of hers, of a confirmed case, and they are in for observation due to the known, sometimes long incubation period of this virus. There are, in fact, 22 other known contacts of positive cases in the country at large. As of this morning, the French Health Ministry said they had all been tracked down and that they had all been moved into isolation wards across the country, and where they are set to remain now for 42 days. It was initially said it would be 14. That's been extended, although they've said that they will review this protocol every 2 weeks.
Antonia, what kind of response has there been from the French government so far?
The French government has been responsive, it's fair to say, and has moved fairly aggressively. On Monday, there was a crisis meeting held at the Prime Ministerial residence, after which an emergency decree was issued almost immediately, creating, on an emergency basis, the necessary legal framework for any known identified contacts of infected patients to be tracked down and isolated quickly. Now, the government remains, though, insistent that we're not looking down the barrel of a major crisis. They've said that if in the instance in which there is an epidemic, they have 3 months' worth of masks standing by. But they have said that we're not in this situation. The risk to the general public is fairly low, and that the state's goal is to build a thick wall around these isolated lines of transmission. They're also currently working on a protocol for contacts of known contacts of infected patients for that second degree of protection.
Antonia, thanks for that. Antonia Kerrigan there at the Bichat Hospital in Paris.